This video demonstrates how to support your patient's participation in the National Cervical Screening Program. Once you search for your patient and selected their bowel screening record, you'll see the corresponding tab on the main banner menu. If your patient is also eligible for the bowel program, a tab for that will also appear, allowing you to switch between the two. At the top of the screen, you'll find key identifying information, the dates and status of their last and next screening actions, and where relevant, any alerts corresponding to the patient's screening status, which can be viewed by hovering over them. From the Forms tab, you can submit clinical information, access your patient's screening history, and view previously submitted clinical forms and results. Check screening history to view and download as a PDF. Submitting clinical information for your patients is crucial and helps to ensure that patients are placed on the correct screening pathway and receive timely reminders and follow-up. Without it, delays in care may occur, and our follow-up team may need to contact you if a patient has a high-risk result. The following clinical forms and reports are available for the National Cervical Screening Program. Please note that some may not display, depending on the patient's screening pathway. This list represents all available forms, not necessarily those for the test patient in this demonstration. Colposcopy referral notification. Use this form to notify the NCSR of colposcopy details or alternative management for a patient with a high-risk cervical screening test result. This ensures that your patient is appropriately monitored and managed. The form is also used to advise the NCSR of future colposcopy referral details and dates. Colposcopy data collection form. To be completed by a colposcopist to inform the participant's clinical pathway, supporting the NCSR safety net function by ensuring that high-risk patients are followed up appropriately. And total hysterectomy. Notifies the NCSR when a patient has had a total hysterectomy. Once the notification is submitted, a total hysterectomy alert will be set against the patient's record. You can also submit the following forms to manage your patient's participation in the cervical program. Defer cervical program. To change the date of your patient's next screening, perhaps because of travel or other reasons. Opt out of the cervical program. This will end your patient's participation in the cervical program. Your patient can still book in a cervical screening test with a healthcare provider. The results won't be recorded in the NCSR, and they won't be sent reminders to screen. They can resume participation at any time via the participant portal, calling the NCSR, or at the request of their healthcare provider. Cervical program correspondence preference provides the option for your patient to receive postal correspondence or cease all cervical program correspondence. The Correspondence tab displays all invitations, reminders, and other messages sent to your patient for the cervical program. The Participant Details tab displays demographic information which can be updated, including name, gender, address, and contact details. Any updates will not change your patient's details held in Medicare. If your patient needs to update their Medicare details, they can do this by visiting servicesaustralia.gov.au/Medicare. Nominated healthcare provider, which can be updated for either program your patient is participating in, and Indigenous status and country of origin details. The Notes section allows you to enter and view notes specific to your patient. Only the notes you add will be visible to you. To find out more about the National Cervical Screening Program, visit health.gov.au/NCSP.